Hello everybody and welcome to this month's vlogcast. I'm here in Cork and delighted to welcome Dr. Eibhlin Conneally from St James's Hospital in Dublin. We've known each other for quite a few years now, and the first time I think I met you was Maz and I came over for a Dublin forum and there were not a lot of people there, and look at what we've got here today. It's wonderful.
Yeah.
Eibhlin, I'm just curious really, and your interest in MPNs, and you've been involved for a long time with MPNs. Where do you see them going from here? The evolvement of MPNs.
Yes, so I mean, I suppose it's been such an active field over the last 10, 20 years. The scientific discoveries have been incredible in terms of understanding the mutations, and now really the hope over the next 10 years is that can be translated into new medications that will change the natural history of these disorders. So that's really what we're all very excited about the possibility of.
That sounds really, really exciting. And also I wanted to ask you, because the Mosaic study, I know that your hospital is going to be, and you're going to be involved in that. Would you like to tell us a little bit about that?
So one of the questions lots of people have about myeloproliferative disorders is, where did I get this and how did I get this? And the Mosaic study is set up to try understand that. And we're looking at patients and then a body in terms of trying to identify differences between patients and somebody who doesn't have the disorder, and to see if we can identify things that might be important in causing these disorders.
That's really exciting. When does it open for you in Dublin?
Probably within the next 3 months. It's been quite slow to get off the ground, and COVID has delayed all of these things. But we're hopeful probably by the end of the summer it will be we'll be ready to recruit patients. And we will recruit patients through our outpatients clinic. We will have information sheets, and then people can sign up for the study. Yeah.
You've been practicing with MPN patients for a long, long time. Have you seen a massive increase in patients with MPNs coming into your hospital?
I suppose probably the prevalence of MPNs hasn't changed. But what is happening is that people live with these disorders for 10, 20, 30 years. And I've been in practice for more years than I care to remember. And I've built up a relationship with a lot of people. You know, some of them are in my clinic for over 20 years. And I suppose that's one of the things I like about MPNs, is that you do develop long-term relationships with people, and you see them through different stages of their life and different stages of their blood disorder.
I think that's really relevant. I was diagnosed in 1991, and there were few known patients around then. And I also think that the information for a newly diagnosed patient is so much better.
Yeah. Because
that word neoplasm,
yes.
It changed. I know
Yes.
the World Health Organization changed it, and the downside was the word cancer, because I was diagnosed with a blood disorder. But the plus side is, generally speaking, and I know it's different in each country around the world, but certainly in the UK, it's meant that we have better access to better drugs.
Yes.
And is that the same here in Ireland?
Yes, I suppose certainly MPN Voice do a fantastic job in terms of supporting newly diagnosed patients, both from the literature and also the website and the forums, and like meetings like we're doing today. And I mean, the medications have been slow coming, but there are so many that are so close. We are hoping that will make a big difference to people over the next 5 years.
Well, that'll bring a big smile on lots of people's faces. Thank you so much, and it is always a joy to meet up with you for these forums.
Okay, thank you. Thank you very much.